Do our sampling for our dermaphyte or fungal testing. So this is Nikki's little pit bull. She's got some chronic skin lesion issues, most notably on her lips here. She's got some crusty skin issues here in the folds of her lips. So fungal testing should usually be done whenever you see any kind of a crusty or lesion area. As part of a skin workup, you do a scraping, you can do a tape, fungal testing, just to kind of rule out different things that are going on. Cats are a little more infamous for having fungal issues like ringworm, but it should still be done with dogs as well. So there's a couple different mediums for fungal testing. They have the culture plates. This is a culture tube that we're going to use this time. In order to collect the sample, we have some sterile hemostats or forceps and a toothbrush. You can do the toothbrush method as well. So I'm going to just grab the handle. So you want to pluck some hairs. Hopefully you can get some good roots with those hairs as well, so that you can make sure you get a good sample. And you want to get about 10 to 15, so we're just going to grab some hairs. Oh, hang on, honey.
Good girl.
Good girl. So you can see my hairs on my forceps. And we're going to place them in the culture medium. You don't want to bury them completely in the medium, but you do want them to be seated in there so that you can press them in, and that they're seated in there, but you don't want them to bury them completely. So there's some good hairs in there. So we'll use that, as well as now we'll do the toothbrush method. In the end too, when we make sure we screw the cap back on our culture tube, you want to make sure that it's not screwed down completely, because if there's no airflow, it actually will not work properly. So you don't want it to be open necessarily completely, but you don't want it to be sealed shut, otherwise it will never work properly. So we're going to use the toothbrush method as well, which is a pretty simple process. You're going to go against the hair and stroke the area, the lesion, about 20 to 30 times. So we're going to go against the hair growth. We're going to go this way, so we're going to go like this. Oh, hang on, honey.
Okay, good girl.
3, 4, 5. I know. It feels weird.
It feels funny, huh? It's just like a toothbrush.
I know.
Just like getting your teeth brushed.
Hold on.
It's kind of like getting my teeth brushed. Lip brushed.
Good girl.
Good girl.
So same idea, you're going to press it into your medium.
Girl.
You can see my little bits of hair on there.
That's a good girl.
So we'll just stick my toothbrush in.
That's such a good girl.
And you can see me pressing it into my medium. You also can clip the tips of this toothbrush off and leave it in the medium as well if you want to try to get a good seated sample. Just one last thing to make sure you actually label your tube properly with your patient label, as well as the date, because you're going to be checking this daily for any color change or growth. So you want to make sure you date it and put it in a drawer or a cabinet where it's away from light and is pretty medium temperature. You don't want to be too warm, but you don't want to be too cold. A little warmer is better than too cold, but for the most part you can just put it in a drawer or a cabinet on the room floor and it should be fine. So here is our fungal testing tube that we have had in our dark warm drawer for the past about 10 days. You do want to hang on to them for about up to 3 weeks. You can't get false negatives if you throw them away too early. So we're been looking every day for signs of color change or any kind of growth. Obviously there's not a whole heck of a lot going on this culture medium. So we're going to still take a look at it though with a piece of tape and some of my cotton blue here, a drop of that on my microscope, just to make sure we don't see any signs of any budding fruits or yeast or anything like that. So we are going to just take a look under our microscope just for short. So I'm just going to do a single little drop of my stain on my side. Not too big, so you want it to go everywhere. Here we go. So you can't use opaque tape because you don't want it to be too blurry so you can't see through it, because you're going to basically be using tape as kind of like almost like a cover slip. I'm just going to kind of wrap it around my finger. Now if you had any kind of budding or fruiting or any kind of like a white fluff or anything that you could grab the center of a colony of something obvious, that's where you're going to get your sample from. In this case we don't really have anything going on, so we're just going to grab a little tap from the middle of where I had placed my toothbrush sample. So we'll just tap right there with my tape. So you can see my little bit of my medium. So we'll just use this, like I had said, as almost like a cover slip. Put my tape back up. over my stain. There we go. So I have my slide. So I'll look under my microscope here. Actually, I'll just trim it to make my life a little less sticky. Go. So I'm going to be looking for any signs of any buds. Not dissimilar looking in some ways to yeast buds, but of course in this case we're looking for fungal buds. But they both are a budding process, as well as anything that is going to be obvious of any kind of fruiting or other fungal positive signs. So, like we had seen, this is a very negative sample, so it's probably not going to be much that I can see in here. I didn't have a real big colony to try to tap to get a sample from, where you can have a real obvious visual sign of any fungal issues. In this case, there's barely even any debris or cells on here. I see one like little root hair bulb from us doing our sampling, just a regular old skin cell. So this is participation in a necropsy. We have a little layer hen here, a little Rhode Island Red. I actually came from my family farm, came out and found her deceased in the coop last night. So she's been in the morgue overnight. And we're going to perform a little necropsy on her here. So you perform a necropsy basically to see if you can diagnose the reason why they passed away. You can certainly confirm a diagnosis you already had pending, or in this case, because she is part of a group of hens that can live in the same area, if she has any kind of a disease that can be passed on to the other hens, especially as they're working hens and their eggs are being eaten, want to make sure there's nothing contagious or dangerous about her eggs, or any of the other hens that were in the house can't catch anything from her. So we're going to perform a little basic necropsy here with my doctors coming in. We have our formalin jars here that are already labeled. We're going to take a little sample from the spleen, the liver, and the intestines. And tools-wise, if you look over here, in general, there's no specific tools that are only necropsy only. Basically, you need the ability to be able to make an incision, remove any samples that you need. If you have a larger animal, you might need some larger, more robust tools like scissors or knives, or larger tools to break things like ribs or sternum to be able to reach the internal organs. In this case, we have a small chicken, we're not able to use any of these. So this is Dr. Martin. She's going to be performing the quick necropsy. I just wanted to point out that we are wearing protective equipment, so you should at least be wearing gloves, mask, and gown. If we're doing a large animal, we'd be wearing apron, boots, face shield. If you're doing like a cow or a horse where there's more chance of splatter or injury, in this case we have a very small bird, so we just have the basic stuff on. So I'm going to hand it over to my doctor.
So we have a deceased layer hen here. Unknown cause of death was found this morning by Alyssa at our family farm. First thing you do is just start with a general overview before you kind of get to the nitty-gritty. You can see in this case she's an older bird. She's got loss of feathers, loss of muscle mass, changes to her legs as well. So just kind of a brief overview of just external changes. And then what we'll do is we'll start with a necropsy and we'll make a midline incision. So you can see we've cut in. Now we're on the abdomen here. So what we'll do is we'll basically...
I'm going to come around this side. That might work better. There you go. Yeah.
What we'll do is we'll just get some tissue samples and evaluate each organ.
Is that spleen? Liver. So there's my formalin jar. It's labeled liver. So you just want to make sure you don't splash any of this anywhere because it is carcinogenic. Just drop that in there for me. seeing anything abnormal?
Not so far.
There's intestines.
Yeah, you can see on down there her intestines, and of course everything is a little changed as far as color goes, just because she has been deceased. But I think this might be a big old kidney.
Wow, yeah, that is a kidney. That doesn't look healthy.
Thank you.
Yeah. It's I think it's either a kidney or a potential mass.
Can you get me another biopsy jar? Just a formalin little biopsy jar. So we're gonna get an additional biopsy jar now that we found something to take a sample of that's abnormal. Top drawer. Top drawer under the catalyst. It might be a tumor. Certainly doesn't look normal.
Maybe this is. I think we may have two structures here. I'm not too sure.
You just put it right there. Okay.
Of course, in these guys, everything is very adhered to the body wall, and it's a smaller space than, say, a larger animal like a cow or a horse. But basically, what we would do is run gastrointestinal tract and get a sample of each portion. But overall, I don't see any other major abnormalities.
Well, let's just get a sample of that little not so friendly friends there. So this jar is currently unlabeled, but I'll label it now that you know what it is. It's very strange. So there's at least two of my samples. As you can see, we'll keep going and we would get a full set. So I just wanted to show that we did end up labeling that jar, that additional jar that had been grabbed for me. So after cutting into it, you can see with the contents now that are swirling in the container, Dr. Martin actually thinks this might be stomach that we had found. But if it is stomach, it was either impacted or ill because it was very hard and abnormal tissue. We get our vaginal cytology, so I have my supplies here, so I have my slide. These are sterile cotton applicators, but they're wooden sticks, so we're going to use just the cotton tip applicator part of the coulterette so that we don't have to stick something wooden when we're doing a vaginal sampling. I have my saline here. I'm going to wash my vulva with, this is Chlorhex with alcohol. You can do Chlorhex with sterile saline. This is our Chlorhex with alcohol. So this is holding my dog up here. She's a little bit of a tough vulva, so we're going to wash with our Chlorhex and alcohol scrub here. So this is sterile, so I just don't want to have to resample, so I'm not going to touch this to anything. I'm not wearing sterile gloves, but as long as I'm not touching the end of this, that's okay. And that's not a completely sterile process. So we're going to open this up. There's my, and this is my saline. This is from a sterile flush, so I'm just going to soak the end of my applicator here for my cotton. Just because she's got a little bit of a tucked vulva, I'm just going to give her one last wipe Your skin folds like to fall back over what it is I'm doing. All right. So we're going to introduce our cotton applicator, a little bit of an angle, and then, I know, honey, try and go all the way in. Good girl. So she's a pretty big girl, so you can basically put the entire cotton tip applicator in there, and you're just going to rotate it a couple times, and that is a really good sample. So we're just going to roll this on our slide, back and forth a couple of times. You don't want to press, you just want to roll. So give yourself 2 little lines here. We'll let that dry and stain it and look under the microscope. Here's my slide that I made from my vaginal cytology, so I'm going to stain it. So this is just a basic diff quick, so you can use any stain base that you use for blood. So this is the clean ones. You definitely make sure you're doing clean, not dirty. Dirty is like ears and fecals and things like that. So if you're looking to look for bacteria or any kind of a cytology, you want to make sure you're in a nice clean. So same process as you would if you were doing a blood. About 10 dips, 1 second each, or 10 seconds in each. So 1, 2, 7, 8, 9, 10 in my fix. And then 1, 2, 3, 4, 6, 7, 10 in my stain, and then my fix is my last, excuse me, my counter. 1, 2, 3, 4, 5, just rinse this off with a little distilled water and let it dry. This is my stain slide from my vaginal cytology. We're going to look at under the microscope. We're going to be looking at levels of erythrocytes, neutrophils. Mostly you're going to be looking really strongly at your epithelial cells because it's going to let you know what part of the estrous cycle they're in. And we'll talk about the estrous cycle itself in a second here. So let me just turn the light. Here we go. So I'm going to look in here. And in here. Alright, so we are looking for epithelial cells and going just a little bit closer, as well as level of erythrocytes, whether or not I see bacteria, whether or not I see parabasal cells, whether I see clonified. So there is some debris, but that's kind of come naturally. So there are some red blood cells, there's some erythrocytes on this sample. So usually a dog in anestrus, or the inactive or basically dormant stage of the estrous cycle, there is no erythrocytes, it's just epithelial cells. And in this case I am seeing some red blood cells. However, my dog, as you saw, moved during my sampling and there's a little bit of blood on my applicator, so I don't think that she's actually in pro-estrus. I think that was just a little bit of trauma from the actual vaginal wall because of the fact that she was squirming around. So we'll have to take that finding with just a little bit of grain of salt because she is not showing any other signs of being in pro-estrus. So this dog, I'm just seeing some epithelial cells. I'm not seeing anything that would show that she's in anything other than the inactive or the anestrus stage. So there's 4 stages to the estrus cycle, and she is in that dormant stage. It lasts anywhere from 3 to 4.5 months in female dogs. They will not accept or attract male dogs. It's basically like their reproductive system is at rest, and there's no discharge or red color change to their vulva or their mucosa. It's basically like a dormant stage. So we'd already talked about anestrus, or the inactive stage of the estrus cycle. So the next stage is proestrus. So the female dogs in that stage have a reddish, bloody tinged discharge. They have a red swollen vulva. They do attract, but they do not accept male dogs. This is the It's a part of the cycle where the owners report a bloody discharge in the house, where they might need to wear some sort of a sanitary little diaper guide. So you see a marked increase in erythrocytes, and the cells, the epithelial cells become cornified when you look on the microscope at the end of proestrus. So as it kind of, the erythrocyte starts to drop down, the epithelial cells start to show cornification. So that's proestrus. And then the next part of the estrus cycle is estrus. A female dog in estrus just came out of proestrus, so the vulva might still be swollen, the discharge might still be present, it might be slightly bloody tinged, but should be more of like a white color at this point. They do accept male dogs and attract male dogs at this point. In terms of microscopically, erythrocytes may still be present, but they're in fewer numbers. All of the epithelial cells are cornified at this point. At the end of estrus, the erythrocyte count drops even further, and the neutrophil count goes very high at the very end. Both this and the proestrus cycle are to about, on average, about 9 days long. Cycle is medestrus. Medestrus takes place after estrus. There's still some swelling of the vulva and things, but things are decreasing. They no longer attract or accept male dogs. The cornified epithelial cells are replaced by non-cornified epithelial cells. The neutrophil count increases up to day 3 and then decreases down by day 10. This part of the estrus cycle lasts about 2 to 3 months. It is hard to distinguish it from diestrus or anestrus, or the inactive part of the cycle. On cytology, it's a little difficult to tell between the two. So I'm going to sit up and get going here on my manual cross-match. So cross-matching is done whenever you're doing a blood transfusion. We often do packed blood cells or whole blood from a donor, or plasma in the ER. These are our major cross-matching kits that we have that are commercialized, that we have available to us, that are easy, they're step-by-step. We're going to be doing a manual version today. So there's 2 kinds of cross-matching, minor and major. Minor is donor serum recipient cells. Major is donor cells recipient serum, so they're basically opposite of each other. And you're going to be looking for any signs of any autoagglutination or issues with the transfusion where you might be worried there's going to be a transfusion reaction. So I have all my samples here, so we already drew our blood earlier, so we have donor and recipient EDTA, donor and recipient serum separator that's already been spun. So I'm going to take my pipettes here and put my serum in my non-additive red top tubes. So from here on out, to make life easy, all my samples are just labeled donor and recipient, but they are properly labeled with the animal's name to start with. So we're going to just put our serum in our non-additive tube, just to paint it off here. So there's one. Just make sure you do not use the same pipette that was in my trash. So we're going across. So there's a little bit of bloody tinge to this serum. Sometimes that just happens when you're spinning it. It might have been from the sampling. So we just have to keep that in mind when we're doing our matching later, that if we're seeing a little bit of ready tinge to what's going on, it might not be actual hemolysis an issue, it might just be because of the color of the serum. So those are going to stay to the side here. We're going to work with them later. So here's our DA tubes. We're going to put them in our centrifuge here and spin them because we want to decant off the actual plasma. We only want the cells, so we're going to put them opposite of each other so they're balanced, and spin them at 3000 for about 5 minutes. So my EDTA tubes have been spinning here so I can decant off the plasma. So I'm going to take them out. You want to be careful not to jiggle them too much because you can re-agitate the plasma back into your cells, and then you'll just have to respin them because we don't want the plasma for our cross-matching. So we're going to pull them out. You can see my layer of plasma at the top, and we're just going to decant it off with a little bit here and disregard it because we don't need it. One. And once again, you want to make sure you do not use the same pipette. Alright. There we go. Alright. So, all we have is our cells now. So, what we're going to do next is wash. So, I have some new clean pipettes here. We're going to take 1 to 2 drops of our cells them in these clear non-additive tubes here that are labeled once again, and suspend them in some saline and spin them down until the supernatant is clear. So we're going to repeat this process 3 times. So for the first time here, so we'll take my donor sample. 2 drops, 1, 2. This is just saline. You basically want to fill the tube 90% of the way. It's not a specific amount. Alright. There's my donor tube, you can see. Just gently mix. There's one. Repeat the same process for my recipient. 2 drops of my cells. 1, 2. Fill my tube the rest of the way with some saline. Alright. Gently mix those. So we're going to pop these in my centrifuge at 3400 for 1 minute, and then I'll repeat the process of decanting off the supernatant, re-suspending the cells with saline, and spinning them down another 2 times at least until my supernatant is clear. And then we'll be back. I've done my washing. This is the 3rd time, so we'll pull these out so you can see the supernatant, or the top layer here is very clear. So my cells are washed. So I'm going to make a suspension with my now washed cells. So they're both nice and clear. So we're going to pour this off like we had done previously. So we just have the cells there at the bottom. So this is my recipient. So this is my recipient washed erythrocyte suspension. So I have my 2 syringes here with my 0.98 mils of saline. I'm going to pull up 0.02, or basically 2 units of my washed cells from the bottom of my tube here. This is my 2 units. Put that there. Add my 0.98 saline.
This early morning, by that I mean,
There's my washed recipient cells. Here's my donor tube. Donor. Turn that off. Same process.
So I did get the dose it's a sedative. It's actually like agitation program.
2 mils or 2 units.
Okay.
0.98 of saline.
That actually helped quite a bit. Basically, sleeping and resting, which is actually what we want.
There's my now washed cells samples side by side. So we can get rid of all this. So what we're going to do next is we're actually going to do our controls and our major and minor cross-matching. So here are all of my pipettes. So you want to make sure you don't use the same pipette twice, because you can cause some cross-contamination. We'll throw those away because we're not going to use those. So here is my major and minor cross-match themselves. Here are my controls. So the easiest way to make a control is we're going to put 2 drops of the donor and the recipient's cells and serum from the same one in the tubes, because there shouldn't be any kind of an issue with any kind of agglutination or any kind of lysis, because it's the same donor or the same recipient cells. So they shouldn't interact with each other because they're from the same animal. So we'll start out with the donor control. So we're going to take 2 drops of the donor's serum from earlier. We're going to do 2 drops, 1, 2. And this is my donor's washed cell suspension. 2 drops, 1, 2. So there is my donor control. There. We'll repeat the process. Recipient. So 2 drops. This is that serum we talked about earlier that was slightly bloody tinged, so we're just going to keep our eye on that. Remember that that's not actually probably agglutination. It's the actual blood draw. So here's my recipient wash cells. 2 drops of that. 1, 2. Alright, so those are my 2 controls. So those should not show any signs of any issues because both of the samples come from the same animals. There shouldn't be any issues with agglutination or any problems with those. So they can sit there. So now here's my major and minor. So we'll do our major and minor. So remember that major is donor cells, which is this, and my recipient serum. So same idea, 2 drops of each. Donor cells. 1, 2. Recipient serum. 1, 2. That's my major cross match. And then same process but opposite for your minor. For your minor, it's recipient cells. 1, 2. And donor serum. So all 4 of these tubes are going to sit here and incubate for 30 minutes. If you have the ability to incubate at a higher temperature, you can, but we're going to just do a room temperature incubation, which happens a lot in the veterinary world and gives good results. So now they all are going to sit for 30 minutes, and then we'll be back to spin them down and interpret. Incubating for 30 minutes, so we're going to spin them just like we were doing when we were doing our wash. We're going to spin them on 3400 for 1 minute, and then we will examine them. Be back. So my tubes are done spinning, so now we're going to take them out and we're going to inspect them for signs of agglutination or transfusion. So that's my major cross match. It does look like there might be some agglutination going on. So there's some suspended cells in my supernatant that look a little suspicious. We will definitely look at that under the microscope. That's my minor. My minor looks very clear. There's no signs of anything going on really in that one, but once again we'll look at that via a microscope. My control is boring, which is good for 1, because if your controls show any signs, then either you've done something wrong with your process. So my other control looks good. So we're going to just take a sample from my major and my minor. Start with the major. I'm just going to put a drop on the slide, and we're going to look at it under high power on the microscope.
Alright, we're going.
So a drop here and take a look. See what we see. So basically what you're going to be looking for are your cells evenly dispersed? Are there any grape-like clusters or lysis? So actually now that we're on the microscope, all the cells are actually really evenly dispersed across this slide. So I don't see any clusters, I don't see any red blood cells that look lysed or they're having any issues. So that slight color might have been from the actual serum, like we had talked about earlier, being slightly reddish tinged color, which might have been a blood draw issue more than anything else, and not an actual sign of agglutination, because there aren't any agglutination looking issues with that slide. So we're just going to take a look at my minor cross match.
That's really cute.
Under the microscope, and then if this one looks very clear. We're gonna, come on, here we go. Good drop on the slide. a look. The other thing that I wanted to mention too is that you should always blood type your patients, and your donors, if they're DE 1-to-1 negative for dogs, can usually get away with donating to anybody, so without having any major issues of likelihood of transfusion reaction. If you have a positive blood donor though, an EDTA 1-to-1, you have a possibility of there being a transfusion reaction if they donate to a negative donor. I mean, negative recipient, excuse me. So, similar to the last one, no clusters of cell scenes, everything's really spread out. Nothing looks lysed or like there's any issues with agglutination going on. So I'd run these results by my doctor, and as long as they concur that there's a likelihood, a low likelihood of any issues of this dog donating blood to the other one, we would go ahead with that transfusion.